Well, Dennis, with all good things come the bad as well, right? All instrumentation protocols, systems, files, whether they're hand or rotary, if used properly, will give you beautiful results. You can expect really high success rates. But if you don't use them right, in the right place, in the right situation, you can have errors that are generated that could range anywhere from ledging, transportation, perforation, zipping, and then the worst of all, instrument separation, which leaves a little souvenir inside the root canal. So let's talk about some of these and talk about some of the ways you can hopefully reduce their incidence. I think the number one thing you could do to reduce the incidence of any of these is to understand the canal that you're dealing with, not rush in. Most of the time people rush to get into a case that is a little bit more difficult that they can handle. Then they end up kind of creating a ledge, for example. Mm-hmm. You know, one of the biggest principles of efficiency is to know when you should slow down. That will make you actually more efficient in the long run, is when you know when is the right time. And that's really the ultimate professional, is someone who can recognize the situation that is potentially hazardous.
It's like a race car driver. If you're
exactly.
going to go around a curve, you got to
right.
Reduce your speed.
And these instruments are kind of like a Lamborghini, right? If you know how to drive them, you can do a racetrack. And if you don't know, you're going to basically crash and die. All right, so let's take a look and see what ledging is, because that seems to be one of the more common problems. Ledging is when you try to basically go down a canal and you don't recognize or realize that there is a fast, sharp turn in the situation that you're in. You try to go with too large of a file, and you create a little bit of a step like that. Mm-hmm. Now, when you create a step, your file that you want it to be flowing while trying to preserve the overall, the original natural shape of the canal ends up hitting this little step, and then it cannot get back into the original canal. Now, part of the reason, the true ledging is when you actually deviate slightly from the main canal. You can also get a ledge if you're packing debris into the remaining canal. So, you consider it a ledge, but it's actually a blockage.
It's a block, yeah.
So the best way to avoid these things is, as we mentioned, is to use a crown down kind of a technique in which you're removing first the top part of the canal. You remove restrictions from the top so that you can have a better chance of negotiating around curvatures, as well as we mentioned, the use of the SSC. Single stroke and clean will remove the debris that you cut, so you don't end up packing it down into the remaining portion of the canal. Mm-hmm. If you do get a ledge, the trick would be to put a hook on your hand file, then work it down, and the hook will act like a little bit of a scouting tip until you can basically get it past. The goal is to get past this little step, this ledge, and back into the main canal. When you get in there, then you just have to go in short amplitudes up and down so you can remove this little step that you've created like this and make it smooth this way. So the goal is to make it smooth, get rid of that so that you can then go back.
If you get this past that ledge.
Yes.
Don't remove it.
Don't remove it. Stay until you've enlarged it enough. Yeah.
A lot.
Yeah, and that, and it is difficult to deal with, especially nowadays with the NiTi files. It's tough to get if you have a ledge. So the best is to first avoid a ledge. If you do get a ledge, using shape memory, you can pre-curve your NiTi file and get around it. If you have an austenitic file that doesn't quite shape, you can actually use ice on it, and then you can bend it, and it'll bend, and you can then get it around that curvature and get that cleaned out. So let's talk about transportation as well. Transportation is when you have a ledge and you continue to work. Or if you have an instrumentation that you stay in one place for too long. Because remember, all NiTi files are straight, and they have a tendency to want to straighten out. All the austenitic files want to do that. So that's how orthodontics work, right, with the NiTi wires.
Sure.
That's how they generate that force to move the teeth. Here, if you put a NiTi file in a curved canal and you keep on rotating it without really moving it, it will start to remove this part of the tooth, transport the canal, and if you continue the same path, you could potentially end up with a perforation. Okay? You can perforate as a result of transportation. You can also perforate as a result of continuing out and being determined to get around a ledge. You can't get around a ledge by force. A ledge or a block can only get through finesse and understanding the tactile feedback that you get. Endodontics, I found out, is the procedure that requires the least amount of force. In all aspects of it, it's just the lightest of touch. It's just about direction, about tactile feedback you get from a file. It's never about how can I get through this calcification, because it never requires that much force. It's just an understanding of what's causing calcification and what is causing the blockage, and then having files with finesse, with curvatures to get around. Now, we talked about perforations and transportation. Zipping is when you basically go past the apex, you create an apical perforation. So you can have side perforations, perforations on the top, in the root, and if you get past the apex without having proper working length and then continue to instrument, you can enlarge the apex in an oval shape, from its original shape, because these canals end to transport and zip the apex, and then you end up having an oval-shaped canal at the apex, which is more difficult to fill, obturate, and seal, and that is something you want to avoid as well. And last but not least would be instrument fractures, which are really a problem. If an instrument fracture occurs up on top, if you have a piece of the instrument that breaks on top, that you could probably remove if you can visualize it using the microscope, right? But the key is visualization. And this is not something that, if you're a general dentist and you're using just loops, you're going to be able to do with an ultrasonic. But this is a case which you have to refer to an endodontist as a microscope. They will enlarge the top enough so that you can create a platform and then use an specialized ultrasonic tip to basically engage the side of this broken file, and then almost be able to see as they unwind and agitated and vibrated out of there. So that's the key thing. But if files break beyond the curvature of the root, it's very difficult to remove them. So what do we learn from this situation? I mean, these might be removable up until the curve. Beyond the curve, I think you reach a point of diminishing returns. By trying to remove them, you end up destroying too much tooth structure. Those cases, depending on the situation under which the file broke, if the canal had already been cleaned completely and then it broke, or how much bacteria is remaining beyond here, and what it's going to cause. It's going to cause an infection or not. Then the situation would be you have to do surgical retrieval or an apicoectomy to address it. Or if it's already been cleaned, sometimes you get away without having a problem and you just leave it as is, and it's not an issue. But you have to keep the big picture in mind that trying to remove every separated instrument may not be the right thing, non-surgical removal, because it could actually damage the tooth more.
So, the most important way to avoid all these problems.
Yes.
Light touch.
Light touch.
Okay? Not trying to force a file at any time. Following techniques such as SSC that continually remove debris.
Yes.
And don't put you into positions that you are trying to push beyond it.
Lots of irrigation to further remove the debris.
Right. And
use crown down protocol, always enlarge from the top. Using that the SX orifice opener is a really great tool to get that original opening up on top that gives more freedom to your file to negotiate around the curvatures that will invariably be there. So a crown down approach, remember what we talked about during the axis, it was two or three SSC strokes of the orifice opener, the SX orifice opener, followed by 1 or 2 strokes of the expediter. And that gives you the whole mid-root opening. Now then you use your hand files, you use you go from 8, 10, 15, and then you have a path to clean.
I'm actually going to add just one last thing to this, which I think is pretty important. And that is, ESX has been basically conceived with the concept of case selection.
Yes.
And I think that case selection for everyone that is involved with what we're talking about here, endodontics at the level that we're talking about it, should recognize their comfort zone.
Yes.
And when things are outside of your comfort zone, when you're looking at an x-ray and you're considering the patient, the tooth, the environment that you're working, whatever your equipment, everything else that you have available to you, is to really think in terms of what I can manage personally and feel good about, and tackle with a real probability of success, and what, in fact, I need to refer and to think in terms of the endodontist as being an alternative.
Yeah, and we believe that if you actually put the patient first, and if you make a decision that is patient-centered, what's best for the patient is best for you and for everyone, then you will do well. Obviously, endodontists are there; they're better trained in terms of the additional training you get into dealing with these things. It's all about understanding of the situation that you're dealing with the canal and the information you put together to build a picture that allows you to then negotiate around it. The additional training that the endodontists get is basically revolves around this, and that's why you need to have a good relation with the endodontist, with the referral. In fact, at Harvard, I joke with the residents there. I tell them, because our program is a 3-year program, we say it's 3 years because it takes 1 year per root to learn how to do these things. But so make sure you keep all of these factors in mind, and if you do things properly, if you understand what your limitations are, what the limitations of the material that you're using is, and you put the two together with the case selection that is appropriate for your level of expertise, you dramatically reduce the incidence of these procedural errors that, in my opinion, can very clearly be avoided with the right decision making. All right, Dennis, I think it's time to come back and arrive at some conclusions about this whole course.
Very good.